now joined by Carrie Amato, who is the Executive Director of Health Innovation, and Rob Havasi, the Senior Director of Connected Health, both at HIMSS. I'm excited to have you guys here, and I want to start with you, Rob. I know that you right now are moderating a panel called Leveraging Telehealth to Achieve Health Equity. And what I think is interesting about this is the idea of actually making health equity equal with technology is not something I've heard. It sounds like a little bit of a paradox. So talk to me a little bit about what you are hearing in this panel.
Yeah, for sure. It's one of those problems that's a little bit complicated and changes very quickly as you move around geographically.
Okay.
So disparities that we find in the United States are different than disparities we find in Europe. They're different than access issues and disparities we may find in other parts of the developing world. And so in some cases, telehealth and technology, as we've learned through COVID, can be a bridge to communities that have traditionally been underserved. Many communities, immigrant communities, communities of color, are very well connected for reasons of keeping in touch with family or other reasons. And they were very quickly able to pivot and use that technology to actually increase their contact with the health system.
Wow.
But we're finding in places like Asia right now and in Africa, and some of the things we're going to talk about from people who are on the ground in these places, they're finding real connectivity issues where there are still big gaps in areas that lack coverage at all, lack the ability to have even basic telecommunications to facilitate healthcare. And there are strategies we can employ to use technology to get there, but they require a concerted effort, government and private partnerships, and a whole lot of other things to really build that bridge.
Wow.
So can I build on that for
Yeah,
just a
build
second?
on that bridge.
You know, I know, Rob, I worked with you and the team here on some additional research we did this year on consumer preferences around telehealth, digging in on, so COVID happened and a lot of places, implemented telehealth. A lot more consumers used telehealth, and so we dug in on what did they really like, what didn't they like, what worked, what didn't. So I'd love to hear from you, after looking at that data set, a little bit about what did we learn, particularly around the trust premium.
Yeah, I mean, the trust premium is a really interesting topic. And as part of a podcast series that we do, the Accelerate Health podcast, I had a chance to interview the medical director of Ro. And that's the parent telehealth company of Roman that you may see on TV commercials here in the United States, or Rory.
Sure.
Right? They provide everything from birth control to hair replacement or hair loss drugs and some other things. But they're also, at their core, a primary care telehealth company.
Wow.
And what I heard from their medical director was that many of their patients were first-time users, not just of telehealth, but people who had no established relationship with a primary care physician. During COVID, they were a little bit worried, they were a little bit scared. They turned to their phones, they turned to some technology, and they reached out to an easy-to-access healthcare organization. And so it really was, in the United States anyway, beginning to bridge that gap. And that gets us into a little bit of the preference stuff that we've learned. Across all the questions we asked about who's using telehealth during the pandemic and who intends to keep using it after the pandemic, we talked about income, we talked about education, we talked about geography.
Age.
And age was the one factor. The younger you are, the more you express a preference for telehealth. And in fact, the more you express a preference for modalities of telehealth that older people don't like.
Yeah.
Everybody thinks of telehealth as video. Younger people are saying, no, I like messaging. I message with other people about very personal things. I establish and form relationships over text messaging or over messaging services. I can use this for healthcare. And the younger you are, the stronger your preference is. The other interesting factor that Carrie mentioned about what we're beginning to call the trust premium is we asked very specifically about what would you pay for a visit? What would you pay for a visit with a trusted provider? So a doctor you have a relationship with, or what would you pay for what we called an on-demand provider? Across the age spectrum, everybody valued a trusted relationship more in real dollars.
Wow.
They're willing to pay a higher rate for a doctor they know and who they believe knows them.
Right.
And so one of the big questions facing this and all technologies going forward is, can we form those kinds of meaningful relationships between doctors and patients, and lasting relationships that can lead to stronger and better revenues for telehealth providers, but more satisfaction for users?
Wow.
That's a big question.
And that age piece, you know, it makes you wonder then if you're sitting here and you're looking, where do I invest my dollars in the future?
Yeah.
As that younger age is saying, hey, I use the telehealth, I will use it again. You know, how much do you invest there versus the brick and mortar? And there's a little bit of a dance that we're still straddling here, but there's definitely, it's skewing on the younger side towards more telehealth, which is important to know.
You know, it's interesting, earlier today we were able to interview someone named Abner Mason, who is actually working with disparity and one of the, you know, populations that are low income or whatnot. And he is also finding that one of the best ways to communicate with his constituents is text messaging. So isn't it interesting that here we are now in this whole new realm of telehealth, where maybe over time we're going to start to have a proof of concept that it's not the video, that maybe there is trust that's able to be established simply by messaging.
And particularly for us in the United States, there's a good amount of data, particularly coming out of California, San Diego, UCSD, and UCSF, San Francisco, about access to technology among the most disadvantaged, right? So among homeless populations in California, which we've heard are exploding, almost everybody is connected. Even people who haven't been housed in months have a connection. And as a bit of a personal story, when I first went to work in healthcare, I worked in downtown Boston. And I would pass on light poles and telephone poles every day a new poster about which church, which community group was offering a warming center in winter or was feeding the homeless on that particular day. Within just a couple of years, by 2008, 2009, 2010, I never saw those pictures, those posters anymore. And I asked a friend of mine who worked for a church mission. And I said, what happened? Is budgets tight? Are you not feeding anything? And they said, no, everybody has a phone. We send out one text message. We don't have to staple anything to phone poles anymore. And this was 10 years ago.
Right.
So by now, here in the United States, technology has penetrated everywhere. People will give up their housing before they give up their cell phone.
So let me ask from another perspective, and I'll ask both of you guys, that in as much of the convenience factor, potentially building trust with a doctor electronically, talk about the power of community. Talk about the power of actually going to a brick and mortar and having someone say hello. In the world of patient experience, you know, talking to the Cleveland Clinic, they talk about experience from the moment you park your car all the way through.
Right.
What is the importance of that in this day and age?
Yeah. We found in our survey, particularly among older patients, right, that personal connection, that personal experience really matters. The white coat, the sterile room, the facility that just says this is serious healthcare.
We're going to take care of it.
Right, matters to people.
Yeah.
I think what we're learning throughout this pandemic is that we have to learn how to use digital to deliver healthcare in new ways. We have to rethink what a meaningful experience is, because we know that younger people form lasting, meaningful, romantic, and other relationships solely on text messaging.
Yeah.
An undergraduate student of my wife's flew to Oregon during this pandemic to go live with someone who she had only met in a group that started as a gaming group and broke into other groups from there. And that is a true and meaningful relationship with
It
her.
worked.
Right.
Well, and I think that's where you got to figure out where digital fits, right? Like maybe it works better on behavioral health than some of these other specialties. And so I think, you know, we're not going away with brick and mortar. It's figuring out where are we seeing it be the most effective? How do we scale that?
Yeah.
What are the lessons to be learned there? And that's really the next, I think, challenge in this, figuring out how this brick and mortar versus all.
And how do we not just digitize what we do today, but where do we use digital more effectively and differently?
Right, having a better strategy, because as somebody, you know, who's looking at health and innovation, you could certainly speak to how many people are putting things out there. Oh, this is going to help. This is going to help. This is going to help.
And that's what I love, Kate, because that conversation that we're having about texting, that's an established practical technology that's been being used for years. And instead of the new shiny object, it's something that's been there.
You guys,
to
did
figure
we
out how to
just
use
solve the healthcare problem?
Yeah, in 10 minutes.
That was it. It was the most amazing HIMSS show ever.
HIMSS can wrap up on Monday.
Wait, I'll text you about that later. All right, you guys are awesome. Look, for what it's worth, I feel incredibly excited about where we're at, because I do think a door is open, and it's clear that you guys have seen it too. So we will be checking out this week and finding out what's going on, and I hope you know, we have more to report, you know, as HIMSS and in your respective ways. And thank you guys for being here.
Thank you.
Thank you.
Thanks.